Arch pain is a common complaint among patients who visit my podiatry office, exceeded only by heel pain. While common in athletes, even my less active patients can suffer from it. Today, I'll be discussing the causes, treatment, and prevention of arch pain. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook to help you learn more about a condition that can result in arch pain. Stop living with stubborn heel pain. You can find a link to download it in the description below. If you find the information in this video helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. Arch pain can come on suddenly, for example after a run or a long walk, or it can develop slowly over time. Understanding the cause of arch pain starts with an appreciation of the arch's function. Each foot has two arches. The medial side of the arch, that's toward the midline of your body, and on the outside, the lateral side of the foot. These structures work to support your weight, absorb shock, and help maintain balance while allowing flexibility to prevent injury when you move. Your foot arch type is inherited and often determines the types of foot problems you're more likely to develop. For example, people with flat feet are more prone to developing several different foot conditions, including plantar fasciitis and Achilles tendonitis. That's because when your arch is flat, you're more likely to overpronate or roll your feet in every time you walk or participate in sports. This overpronation puts stress on the plantar fascia, pictured here, running from the heel to the ball of the foot. You can develop pain in your heel, your arch, and even in the Achilles tendon. Overpronation can also lead to conditions like bunions and hammer toes or overlapping toes. A severely collapsed arch is the hallmark of a condition called posterior tibial tendonitis. Getting immediate treatment is necessary to avoid further degeneration of the arch tendon and end up needing surgery. High arches can also lead to some of the same chronic conditions that people have with flat feet experience, but for different reasons. Plantar fasciitis and Achilles tendonitis can develop because of more pressure on the heel and the ball of the foot. In addition, having a high arch foot can cause a few other conditions. First is metatarsalgia, which is pain across the ball of your foot. This can be particularly problematic in people who wear high heels, cowboy boots. Often occurs in hiking and going downhill because of the added pressure in that area of the foot when that arch is high. Calluses are more prone to develop on the ball of the foot and the heel of the foot due to the increased pressure in those areas. Those with high arch feet can have poor ankle stability and have an increased risk of rolling over on the ankle and having a sprain. High arches that aren't properly supported can lead to arthritis of the foot, particularly across the middle of the foot. Fortunately, there's a lot you can do to prevent pain in the arch of your foot. First, I'll talk about how arch pain can be treated at home. If you're experiencing pain in the arch of your foot, limit your activities. Don't keep working out or the pain is likely to get worse. Second, treat the inflammation itself. You can do this in several ways. Try icing your arch 3 times a day for 10 minutes by using a bag of frozen peas, or by freezing water in a Dixie cup and tearing down the sides and then applying it to the foot. Massage can be helpful by bringing blood to the area to help heal it. If your doctor permits it, you can also take non-steroidal anti-inflammatory medications such as ibuprofen. Third, check your shoes. Unsupportive shoes can cause the arch and heel to really hurt. On occasion, a change of shoes is all that's needed to treat arch pain, but more typically, it's one aspect of a whole comprehensive program to resolve it. To find out if your shoes might be the problem, check out my video, How to Test Any Shoe for Stability. I'll put a link up above. Don't go buy shoes by brand alone. Shoe companies can design shoes for many different purposes. For example, just because you have a name brand doesn't mean it's appropriate for your sport. It may be either too soft or too rigid. In addition to buying more supportive shoes, it's important to replace the insert that comes with your shoes with an over-the-counter insert such as Power Step or Ready Orthotics. Stretching is an important part of recovering from arch pain for many of my patients. That's because tight calf muscles in the back and tight Achilles tendon are common in people who develop arch pain. To stretch enough to make a difference, I recommend my patients use an Achilles splint for 30 minutes during the day, in addition to doing some more traditional runners or calf stretches. I'll put a link in the video above for how to use this device appropriately. While you might be able to heal from arch pain just using the remedies I've just described, typically most people also need in-office treatment. One of the keys to getting better from arch pain is reducing the inflammation and the pain. While the at-home treatments can help in mild cases, if you have moderate to severe arch pain, you'll need additional professional help. Some of the in-office treatments we use to decrease inflammation and pain are an injection of cortisone, particularly involving heel pain, and can drop the inflammation quickly, although it can be painful. Sometimes, if pain is severe, we'll provide you with a walking boot to immobilize your foot or tape it. Finally, we use MLS laser therapy. This therapy heals the pain and inflammation at the cellular level. I often recommend this to my patients who've had arch pain for several months, or if it keeps coming back. Patients can heal up to 40% faster with this therapy. In addition to decreasing your pain, it's also essential that we treat the underlying abnormal foot mechanics. We use a traditional custom orthotic or custom 3D printed orthotic to properly realign the foot and support your feet in the best way possible. I'll assess your feet and gait by examining your feet and watching you walk. In addition, we'll do a gait analysis with our Go4D computerized gait analyzer. This will help us distinguish between the timing and weight bearing and differences that may exist between the left and the right foot through the walking cycle. We'll use all this information to determine which kind of orthotic will be best for your foot condition and your level of activity. In addition, if you're diagnosed with posterior tibial tendonitis, you may be fitted with an AFO, ankle foot orthotic, that goes above the ankle, keeps your foot from collapsing onto the arch. Finally, let's discuss how to prevent arch pain from developing or coming back. Once you've healed from arch pain, you might be afraid it will return. A big key to preventing arch pain and the conditions of plantar fasciitis and Achilles tendonitis is to be sure you wear your orthotics consistently. Sometimes patients think that wearing them only when they're outside, playing sports, running, or going for long walks will help keep them problem at bay, and then tend to get home and just be running around in stocking feet. Unfortunately, that's not the case. Wearing your orthotics all the time and wearing appropriate shoes are essential in preventing recurrence. If you're an athlete, it's important to use dynamic stretches before you work out and static stretches afterwards. I'll put a link above on how to do these stretches. Also, if you've been away from sports for a while, start slowly and gradually increase your distance or sports time by no more than 10% a week, so your body has time to recover. In conclusion, while many factors can put you at risk for developing arch pain, there's a lot you can do to prevent the first time happening or prevent it from coming back. If you found this video helpful, please remember to like, hit the subscribe button, and hit the bell so you can receive notifications of videos in the future.